Did you know that a three-part NANDA nursing diagnostic statement that is typically taught in nursing education to establish a care priority on a care plan is not the way a nurse thinks in clinical practice? Instead, nurses use the skill of clinical reasoning. Clinical reasoning has 5 essential components. Number 1, think in action and reason as a situation changes. Number 2, capture and understand the significance of clinical trends and trajectories. Number 3, filter and recognize what clinical data is relevant and why. 4, grasp the essence of the current situation. And 5, identify if a problem is present. This is the end result where a clinical judgment must be made. As a nurse educator, when I taught fundamentals, I quickly recognized that students required every task to be broken down step by step in order for it to be understood and incorporated into their practice. Even a basic skill such as hand washing had 5 to 10 steps. I had no idea it was so complicated because I do it intuitively as an experienced nurse. In the same way, clinical reasoning needs to be broken down step by step so students can apply it, understand it, and incorporate it into their clinical practice. Today, I will share 8 essential sequential steps that a nurse uses to clinically reason and identify the care priorities in the clinical setting. These essential steps are part of what you reflect and ask as you are acquiring data before you see the patient for the first time. Step number 1, what is the primary problem and what is the physiology of this problem? You as the nurse must not just memorize physiology, you must deeply understand why your patient has the problem they do. This is essential to develop the critical thinking that is required for practice. Number 2, what clinical data did you collect is relevant and must be recognized by the nurse? This is why I addressed in prior YouTubes, do you know your BMPs or your CBCs? Which labs do you focus on as the nurse so you can recognize relevance and clinically reason? Step number 3, what nursing priority captures the essence of your patient's problem and will guide your plan of care? There are times where NANDA nursing diagnostic statements will fit, such as impaired gas exchange or fluid volume deficit, but students must not be forced to make a NANDA statement fit like a square peg in a round hole where it doesn't belong. Therefore, NANDA can be a no-no, and students must be allowed to simply state the primary problem as a nursing priority without NANDA taxonomy at times. Number 4, what nursing interventions will you implement as a result of this identified nursing priority? As you can see, nursing process is integrated in this step-by-step approach by identifying the nursing priority and then the interventions that will follow. Step number 5, what body system will you as the nurse focus on because of the patient's primary problem? Though you are trained to do a head-to-toe assessment, you as a student must focus on what is the primary body system that's impacted by the primary problem. So for example, if a patient has pneumonia or a COPD exacerbation, you are going to spend much more time focusing on the respiratory component of your head to toe versus the GI. Listening carefully to anterior versus posterior breath sounds is an example of what you will do as part of your nursing assessment. Step number 6, what is the most likely or worst possible complication that the nurse must anticipate based on the primary problem that the patient presented with? Never let your students forget that Jason is still out there. If you are a fan of Friday the 13th, you know that Jason was a killer. And killers such as sepsis are still endemic within clinical care. If you remember the ending of the first Friday the 13th, everything was calm. Alice survived the night. The police were there. The lights were on. The sunrise was present. But out of nowhere, Jason came out of the water and took her down. But it was only a dream. But in clinical practice, Jason is still out there, and he wants to take down your patient. Therefore, you as the nurse must be looking for him and not let him take your patient down. Step number 7. What nursing assessments will you be utilizing to identify and recognize Jason as a complication if he presents himself? For example, sepsis is the most common complication that patients experience postoperatively. The nurse must recognize that elevated heart rate, over 90 to 100 without a good reason, is a clinical red flag of compensatory changes related to cardiac output. Your patient's sliding. You as the nurse must recognize it. And step number 8, what interventions will you as the nurse implement if Jason decides to show his face in your clinical setting? For example, if you identified sepsis as the most expected complication, you know what to assess for. Now what will the nurse do if Jason shows up? Who are you going to call? It better not be Ghostbusters. Therefore, be ready and be proactive, not reactive as a nurse in practice. There are an additional 4 questions that the nurse must reflect on and ask when they see the patient for the first time. I will talk about that in my book, Think Like a Nurse. If you would like more on these essential questions to develop your ability to clinically reason and think more like a nurse, look no further than Chapter 9 of my student textbook, Why Clinical Reasoning is Nurse Thinking, in Think Like a Nurse, Practical Preparation for Professional Practice. Never forget that if a nurse fails to recognize a change of status such as sepsis before it is too late, a patient can die as a result. Therefore, to think or not to think like a nurse can literally be a matter of life and death. If you like this video, please share it, or better yet, subscribe to my YouTube channel, Think Like a Nurse. Also be sure to click the link to my book, Think Like a Nurse, in the video description on this tube.